So I think this was the portion where we have stopped, and we are talking much more about this particular species, specifically with respect to ringworm, and majorly three grades where I find out that there was a subclinical infection. Grade 2 was a clinical infection, and what was the symptoms that due to Tinea pedis species, you are able to see the infection on toes and majority of the foot portion. The only difference over here would be you can see the wrinkleness among the skin types, and also you will see majority of the foots will be very close to each other. So that's a major particular symptoms or sign where athlete's foot infection has been found out. Then we came across and get grade 3. What would be the grade 3 if the same grade 2 clinical symptoms persist? What can be the further for that? So it is called as a grade 3 symptoms, what we call as a bacterial infection sets in and patient goes into bed. Usually, once uh, the patient is infected from grade 2 to grade 3 infection, it takes near about 6 months to treat overall particular person and recovery. Majorly, the treatment can be an griseofulvin, which is a mostly a fungal static. However, some patients are very sensitive to this particular drug, griseofulvin, and they are prescribed other drugs, but they are not even able to tolerate that particular drugs. Normally, that name of that particular drug is an terbinafine HCl. Usually, it has been given in an antifungal treatment to treat the specific fungal infection. However, if the patient is ready to take much more particularly elaborated diagnostic, then 2 to 6 weeks or 6 months would be an best ideal time for finding out that yes, through dermal treatment also grade 3 infection can be treated. With that, we talked about in both the classes about this particular reaction, what we call as a dermatophytid reactions. Usually, whatever the skin type or skin infection is seen on the upper layer of the particularly skin, right? So, but hardly it has been found out that fungal infection apart from and systemic, because we are right now talking about cutaneous fungal infection. We usually observe something that it is on the foremost or epidermal dermal part of the skin, but there are few particular signs or few allergic reactions or reactions where there is a specific ulcer type system or mucus system you will be able to see inside the skin, and it is coming out of the skin from the inside part of your skin, right? So this becomes very unusual, and the problem with dermatophytic type of reaction would be that we are not able to find out exact cure for it, because if it would be exactly on the dermis side, then you can take or you can spread any type of antifungal antibiotic onto it. But because it is internal, we cannot directly apply a cream or we don't have any injectables for it. So such type of reaction needs to be taken or special care should be taken for that. And once we are able to find such type of reactions, Then and then only we will be able to understand what is exactly causative agent of it, why this has happened, if there any biochemistry involved in it, then we can go for a further particular reaction. But this is something what we find out as a rare reaction, and we called it as an dermatophytid reaction. Usually this is a dermatophyte because it is on dermat, and specific reaction is there on dermal. That's why it is called as a dermatophytid type of reaction. Now usually there are also in what we call as a body ringworm. Now generally it is restricted on the edges of the skin, what we call as a stratum. So that's why it has been restricted to a stratum corneum of the smooth skin. Why this has happened? Because there are specific toxins or allergens which has been secreted by a fungal species, right? So usually we heard about that there is a secretion of specific bacterial toxins once it enters into the skin. But now whenever the any type of metabolites, usually it can be in toxins or it can be allergens, whenever it is secreted from in the fungal spores, the resultant reaction, that is what we call as a symptom, which is due to this particular fungal infection. And this is what it does not include just a specific portion of countries. Majorly all the countries or all the thing, all the part of the world or disease is spread throughout the world, right? And what it does is it is causes a specific ring like structure on the skin, and this ring actually uh, inflate, just like in as soon as you have seen in the tube, as soon as you fill air into that tube, that particular tube inflate itself and raise itself. Now similar happens over here, but the edges of the skin where actually the infection is there, that edge is actually raised itself and inflate itself, right? Inflate means it rise itself, and then the curling happens over there. So usually because it is a ring or like lesions on the skin, it is usually been observed in that particular portion of the skin. Now you it is been found that tinea corposis, right, is usually a causative organism for body ringworm, Tinea corporis. But apart from this, Tinea corporis has a many of different forms or different species associated with it. So that's why if we are talking about the species associated with it, it can be Tinea rubrum, Tinea mentagrophytes, Tinea torsurans, Malaysia kensis, Malaysia odunini. However, these all are because it is going to affect stratum corneum of the smooth skin. So it is going to affect your dermal part of the skin. All can be treated with antifungal cream, right? Now, antifungal cream can be anything which is associated with or having a compound like ketoconazole, miconazole, tolnafat. All these are in specific, particularly antifungal antibiotics specifically available in the market with a specific treatment or specific, particularly usually used for any type of ringworm which is associated with a tinea species. You further, how does it transmit itself? Now, transmission of the fungal system, it is unusual compared to bacteria, right? Usually bacteria, we have seen that it due to contaminated water, due to contaminated food, or something which is having and particular like a respiratory droplet. But usually this particular contamination happens wherever it finds a specific surface area of exposure. Now, what is a surface area means? If you see and understand the symptoms, basically, our skin is having the highest surface area of our body. Now, due to this particular highest surface area on the body, what will happen? One infection or one patch will be there on one part of the skin. Further, that particular patch will infect another part of your particular skin. So all these particularly things which are is there is getting spread over, and once it is spreading, it is usually been found out that it cannot stop easily, right? So that was it takes much more time, because once it spreads on in one particular portion of the skin, it spreads through whole your particular arm. Suppose it starts from shoulder, then it spread all over your arm. Now once it is there in your arm, then it will spread to the particular your particular chest, and once it goes into that particular portion, even you apply the specific antifungal cream, it will take much more time to eradicate the whole symptoms associated with it, right? Now for treatment or for initial particular, what we call as and how to work with and treatment, we can use ammoniated mercular ointment, which is having a specific ammonia and mercury into it, or else you can have an ointment with an 3% of salicylic acid and a combination of sulfuric acid. Now, over here, you need to note it down that sulfuric acid is not totally concentrated over here. What we think that it might be that there is a high concentration of sulfuric acid which is used over here. Uh, no, it is not that, right? That there is something which we think, right? So for further, you can use tincture of iodine for several weeks. It can inhibit, but still exit. It cannot prevent the fungal movement of the body. The only thing which has been found very useful and antifungal or antifungal static also, or what we call as a fungal static also, is usually a molecule what we call as an griseofulvin. But effective treatment, it takes near about 6 or 7 weeks for its effective treatment, and it is normally in 3 times a day, right? After cleaning your skin, it is normally in 3 times of a day particular thing. So this is how what we call as an body worm looks like, or body ringworm looks like, right? So initial symptoms, what I was talking about was like this, right? Very simple, but we don't understand it much more. So very simple like this. The only thing again, I remember you that if we want to bifurcate and fungal infection over here, then this particular portion would be the best one. That usually the skin is infected with just like an bacterial infection, but this is the portion which we need to look about. You will never see such portions in any type of bacterial infection, right? Always it will be there that and small wrinkling in the skin is observed at the edge of the particular circle, and still over here it is much more clear. And just is, if you see it, you can see the small wrinkles and spots which are there due to small wrinkles and spots. It is getting visualized over here, right? And what happens eventually once this spot has been formed over here like this? Now this particular thing is actually a sporulating thing. Now what happens once this sporulating will find any specific surface, it will spread. So you can see now it is spreading, it is actually getting spread much more. From one small spot it has become in two spots, and two spots has further actually elaborated into a much more particular sporulating forms. Now, how to differentiate it is an Tinea species or Tinea sporesis species or not? Right? There should be specific thing which we can easily identify that this, yes, this is a specific Tinea species, right? The only way we can identify it, uh, there is an usually white color spot at the edge of circle, right? There is a small white color spots near the edge of the circle, and there it further degrades itself, right? It always further go for small spots creation. You can see this is what I'm talking about, white color small patches there, and due to this patch eruption it will further lead to an and spreadage, and this can be in particular in identification. Yes, this is what we call as a tinea infection, or any person is or patient is infected with an tinea corporis species or like that. And as we discussed that yes, it transfers from here everywhere, from shoulders to particular whole part of the body, and when it transfer to whole part of the body actually, it needs further treatment. Now good thing about all these things is these are all not dangerous, right? These are something which can be easily be curable. It will take 6 months, but yes, we can inhibit the fungal growth and it can be further uh, uh, be cleared from the skin. There will be no spots also even seen on the skin, that yes, there are specific few spots which is there, which is associated. There will be no spots at all which will be seen over there. So totally your skin will be totally cleared, and further it can be done very understood very well, right? So further, uh, there are specific another species of tinea also. What we have understood was an tinea corporis only. Another species of tinea, what we call as an tinea cruris. What this does is, tinea corporis was with respect to an body ringworm. It works with respect to body only. Then tinea cruris is something and your groin or surrounding region. Now groin is what we call as in our urogenital tract, where majority is infection is there, and due to that anaerobic conditions and high moist conditions, usually around our genital tract or urogenital tract, it is normally found, and it is not specific with respect to gender also, right? Now it can be there with respect to men and women both, and it is irrespective of the age also. Usually it has been observed that normally because after 15 years usually this is found, but irrespective of the age and gender, it has been found to infecting both men and women both, right? Over there it is not like that, that it can just inhibit one specific or group of species or only males, right? Now because it was found to associate with men's and women's, but majority of athletes or ships, crews, or those who are working very more, they used to have high excretory glands. Now, due to high excretory glands, continuously there is an humidity, and due to humidity, sometimes if it is not clean, it usually the spores remains and stick to that particular surface for a longer period of time. Now, due to this stickiness over a longer period of time, what will it will do is uh, it will further propagate itself on that particular portion of the skin, right? And few particular species has been found really associated with such type of skin infection. Now, what that species are? The species are Tinea rubrum. It does not normally survive for longer period of time outside of the host, but when it is there inside of the host, it usually is very hard to find out, right? So I am talking about this. Then there is what we call as a epiphytum flocosum. It is usually associated with the epidemics because resistance of anthraconia in the skin cells, and it can survive on rugs, shower stalls, and locker room floors also. Now, usually what you find at rugs, because we clean every time normal rugs, even shower stalls, we clean it weekly or thrice in a week. But the problem even on locker room floors, where majority of cleaning has been done through disinfectants, to different sterilants, or through different detergents, but we never found it, yes, that it can survive all that type of sterilants, it can survive all type of disinfectants, and further it can also propagate from that, right? The another species what we call as in Tritophytum mangrophytes. It is usually of an animal origin or rodents, but the spores of all this, what we call as an Trichophytum mentogrophytes, are very resistant. Now, due to this high resistance, it can actually survive in different type of extreme conditions. And due to such survival at extreme conditions, it further can easily propagate itself in and on its skin very fast, right? And the last species, what we call as an Microsporum gallini, usually found on the birds, turkeys, and chickens. Those who are like uh, eating normally turkeys or chickens, usually they get infected because somehow, even after cooking of that particular meat, and before cooking also, they somehow came into contact with it, and once they came into contact with it, it further propagates itself, right? Now, what can be the particular diagnosis of it? The diagnosis is lesens looks like a whip. Normally, if you understand whip, it is a small structure, but it is very raised on the skin, right? It can caused by its even Candida albicans. Now, major woman infection, what we call as an vaginal infections, is due to Candida, but it is associated with an Tinea species also, that Tinea crucis or cruris, where the Candida species are mostly expressing in combination of tinea. The women are facing and specifically uh, an infection near their vaginal, and that particular red spots has been observed. Similarly, in male also, where the urogenital tracts are been associated normally due to high excretion of the glands, that you will see that the infection is found near to that particular area, and it is a dark red color and very segmented one. The particular curves and the particularly specifically wrinkling of the skin has been observed, and too much of itchiness will be observed at that particular part. So how to we can do is we can take the skin scraping from that particular portion where there is a much more redness and you can see the circles over it, and then you add KOH, Now once you add KOH into it, and then you can observe on in particularly microscope, right? How, what can be the particular treatment of it? Over here the griseofulvin will not work, so instead of griseofulvin, you need to work with a specific cream, what we call as an tinactin, right? And tinactin trademark, you, the particular product name is tolnaflet. Now it is an best prescribed treatment protocol for Tinea corporosis and even in this Tinea curicis. The good thing about is the relief of the symptoms, that you don't feel pain, you don't feel itchiness. It will occur within 3 days. Like after that, within 3 days of the treatment, it can be easily be cured, and it will take some time to get all the signs to get over from the skin, but overall the relief will occur within 3 days. Now area is sensitive, so what you require is um, specific care is to be taken to add all the irritation of the region, right? So this is what we need to understand over here. Then as soon as what can be the particular, you can search and specific thing what we call as an jock itch, right? Usually jock itch is found near the particular urogenital organs, and you can observe it is similar to what we have seen with respect to tinea corposis, but the problem is with respect to, because it is associated with an urogenital tracts, or where the defecation is usually happening, it use excess of pain, excess of redness, because too much of humidity, less oxygen is moving over there, and due to excess of humidity this redness is there. And this redness can be only be cured if we have a specific ointment. There is no specific medications available right now as such for such type of and particular fungal infection, but yes, ointments are there. This is most commonly observed in athletes, plus those person who are above the particular body mass, right? So if they have a high particular body weight, this is also one of the common disease, because uh, due to excess of muscles, excess of the obese right, skin, it usually this happens, right? So this is one of what we call as an another symptom or another particular disease which was caused by an Tinea species, what we call as an Tinea corporosis. Okay. Then there is another species what we call as an Tinea unguium. Okay, UNGUIUM. So you need to, this is two is silent, and these are specifically now associated with nails only. So what we have discussed was that the major element which is most important over here is what we call as an keratin. Keratin is a major molecule which cause or which is mostly resistance to major of the infections. Now, because we are not talking about right now and keratin part, right? We have talked about the skin, we have talked about hair, and now there is a species which is came up, which totally is associated with the ringworm of nails only, right? And what is that particular species? That particular species is called as an Tinea unguium or onychomycosis. It actually exists in two forms. Now, one of the form is called as an Leukonchia mycotica. Now, what is Leukonchia mycotica is basically, it is just or fungal infection is restricted to an initial patches or specific patches of toenail only. What we have also seen in previously, if you remember, anybody of you remember in superficial mycosis part, when we are talking about the superficial mycosis part, That was an part where majorly infection was with only the initial part of the nails. What was that portion or that particular patch is called? That patch is called as an leukonchia mycotica, where the superficial white onychomycosis or fungus invasion of the fungus is restricted to a few patches or pits on the surface of toenail. Only with respect to toenail, it is usually like that, right? Then another form of the same species, another form of the same species is what we call as an invasive subungual dermatophytis. Now, what happens is that usually lateral or distal edges are involved, and infection is found beneath the nail plate, right? Not on the upper portion or not. It is infection is there, but we don't observe it. We don't find any type of symptoms associated with it. However, we always found it is something beneath our nail, and invasion of nail plates beneath through it usually happens. So that's why it has been associated that it lies in two different forms. One we call as an leukonchia mycota, and another one we call what we call as an invasive subungual dermatophytosis. It always usually happens in beneath the any type of nail plates. Now, this both are again what we call can cause an onychomycosis, which are a non-dermatophytic fungi or yeast, mostly caused by Tinea rubrum, erythrophytum, and trichophyton species. Tropical treatments, there are no specific such tropical treatment which is available. The only thing is either we surgically or chemically remove the nail, because there are hardly any specific ointments available or specific cream which is available in the market, which has a property to treat the keratin, right? So that's why over here there is no particularly some cream which is available, or what we call as an specific cream which is available over there, right? And subsequent griseofulvin therapy can be there, but it results only 29% of cure rate has been found out with respect to such particular treatment. So treatment over there is almost very less. And how we can just find out, we can find out, or we can have having phenol salicylic acid or iodine can help in combination with an griseofulvin infection. So just an griseofulvin infection or griseofulvin will not work. Over here, it works with a combination of phenol, salicylic acid, and iodine, like KMnO4, phenol, salicylic acid, iodine, in combination of an griseofulvin treatment. So this is what we call as a nail bed. And what we were talking about was this particular part, invasion of nail plates. So distal edges are involved. So usually it is found near this nail bed, and near this particular bed actually the infection, fungal infection starts. So growth of the center of the nail, this is what we call as a cuticle, and this is what nail. Now fungal infection starts from this particular nail tip only. So you can see the from nail tip actually it has moved to the toes, and over here it has been eradicated. However, the nails, you can see the nails are actually having such type of particular discoloration, and due to continuous high exposure of fungus, now the nail overall the detachment of the nail can be done, right? Or detachment of the nail is usually being observed over here. But what is unusual over here that we need to understand? right? The most unusual thing what we need to mark over here is that whenever we are talking about such particular infections, right, you can see the disorientation within the nail. And it is not like it is in one particular specific region. It is, you can see the disorientation is spreading all over the nail, right? Something like, and if we see the aspergillus stain, I am sure everybody might have seen the aspergillus stain. You will see an black color spots over here. You will always see and black color spots. Now similar, can you just observe there is a black color spots just as just like aspergillus strain has been kept for a longer period of time, and then what you observe is similar to like this. And the same thing you can observe over here also, that there is a continuous disorientation with respect to nail surface or nail particular thing is there. So due to this disorientation, or that due to this particular infection, it spread, and you can see the even there is a small particular patch which is now moving on the edges, and it is actually moving on the skin also. Due to such particular high infection or skin, it, it prevails much more. That's why, because it is directly associated with the disorientation of the nail, there is no chance to even treat it, right? If there is a specific treatment, just if there is an just on this particular part, if it would be there, or on this particular part, what can it be? As soon as we cut the nail, we stop the infection. But now possibility or problem is that it is not stopping over somewhere over there. It is not at all stopping over there. It is actually propagating over here, right? Now due to this propagation, we cannot cure which is there beneath the particular skin. We cannot just penetrate injections in this particular portion, right? What we require is, we require a specific treatment associated with this particular part. Now the only specific association with the plant can be either I remove it totally, right? The only possibility is I should remove the total nail which is there implanted on such particular part. Now to remove it, I cannot pluck it out as such simple, because it is very hardly bound with the skin. I cannot just pluck off that particularly nail from the skin. I need to pluck it off either chemically, so that the infection does not enter into the skin, because mind well, this is the portion where the it is nail is entering into the skin. This is the portion, right? And if I just take out this nail, I should make sure that this particular infection which is now actually penetrating should not enter inside. Outside we can treat it. Outside it can be easily treated by, because there are many dermal creams which are available. So outside treatment is 100% possible. But with respect to inside, like inside treatment, uh, inside it won't be feasible, or it won't be easily curable for that. So for that, what we need to understand is, as soon as we remove the particularly nail, we should make it very clear and sterile. Now I cannot definitely use something like alcohol directly, right? So I should either use isopropyl alcohol, or should we have some like solution which contains iodine, salicylic acid, or a combination of antibiotic or salicylic acid, which can prevent the invasion of such particular tissues or such particular infection inside the tissues. So ultimately what we want is, we want prevention of Tinea particular species. Okay. So what I request you, uh, tomorrow we'll start again with respect to Tinea species infection. But tomorrow, before we start, what I want is you search for different Tinea species, and then you come with respect to that. What can be the different mode of infection, or how does it infect? You have ample of time to search, and if possible, you can speak or you can write both, right? So there are total 58 participants are there. In between the session, I will ask, because I'm sure many of you are very, very great. They used to come after or half an hour or after 35 minutes. So in between, anytime suddenly you are joining, I will ask suddenly that you speak, and if it would be better you search for it. Again, the same thing will keep on doing. We'll keep on making one chart. If possibly, if you respond very well, then I will share one Word document. You speak it up. I write the same thing what we used to do in our class. Or else, whatever you search, you speak, and then we'll prepare accordingly. Because right now we have both SA1 and SA2 merged. It would be better that you search and then we'll discuss. It would be helpful for both the classes, right? So it would be great. Okay, Priya, uh, anything? I think by mistake you have written it, because you message me. You should message in group that you are laughing, right? I'm sure everybody used to message in, except me, that what the sir is telling. You used to laugh. You used to have an smileys associated with me. That's great. I don't mind it, but that should be restricted to your group, right? After my sessions, you can laugh on me after once the session is over. That is a normal routine student used to follow in their own group. However, whenever the sessions are going on, they should not do it, right? If there is something in platform, in that platform, you criticize me, you laugh in me, that's all okay. That's a part of it, of my job, okay? Okay, so those participants are present for, there are total 58 participants are there. Fine. So I will share a Google link, and I'm taking a snapshot of the students which are present, except that students, the attendance, please don't pass it to your own student groups. I'm sure you will pass it off, but then I need to refine my search also, right? So great. Uh, See you soon tomorrow. Hopefully, I'm able to see much more participants tomorrow also. They might be just sleeping because they need to take rest to come back to online again, right? So hopefully, we'll see you all tomorrow. Thank you all for attending the session, and thank you.